Newborn Stabilization, Part 4. We need to administer medications to the baby. We use erythromycin eye ointment to prevent ophthalmia neonatorum, and this is due to chlamydia or gonorrhea. What's very important when you're applying the ointment is that you do not poke the baby in the eye with the end of your tube. We put a ribbon from the inner canthus to the outer canthus in the conjunctiva. These babies are going to squint very tightly, so you have to pull those eyes open with a gloved hand and then apply the ointment. Allow it to close and go to the other side. Make sure you do the eye ointment before you give him the injection of vitamin K. And why is that? Well, that kid's going to be crying after you give him that shot. We cannot wipe the ointment off for at least a minute afterwards. And you can see this baby on the left that he's got a lot of ointment that's on the outside of the eyes. There's no harm in leaving it there, but the parents may ask. Speaking of parents, make sure that you inform them about what you're doing and why. Be prepared to do this parent education because they're going to look at you and say, "Why are you doing this to my baby?" So we give a variety of IM medications. So vitamin K, which is in your preclinical write-up, so know the dose. We give it in the vastus lateralis. Some hospitals are very particular on whether it's going to be on the right side or the left side, and then the hepatitis B is going to be on the other side. So just ask your nurse, what's the protocol? Not every baby will get the hepatitis B vaccine right at birth, but will get it prior to discharge. And if the mother is hepatitis B surface antigen positive, we will administer hepatitis B vaccine and the H-big to the baby in the delivery room. Remember, these babies have poor clotting factors at birth, which is why we're giving that vitamin K. So use a cotton ball to hold over your site and then apply a small Band-Aid. And we use those little dots. We do footprinting of the babies. One copy goes to our chart and one goes to the parents. You'll see a variety of tools that we use. Some is on a plate that has black ink. At Fountain Valley, we have a sheet of paper that's white and it magically turns black when it's applied to the skin. And then you start with the heel and then you move the foot forward onto the paper, trying to keep those toes separated enough that we can actually get all 5 of them on the paper. You heard in pediatrics about performing the heel stick procedure. It's helpful if we can pre-warm the baby's heel because we get a better blood flow. So of course you're going to wear gloves, wash your hands. We use alcohol, dry the site with a little cotton ball, and you can see the V area. Those are the spots where we will use the lancet. We have special lancets for the newborns because it doesn't go as deeply as the ones we use in adult health care, so make sure you have the right one. So pause the video for a minute to jot down exactly how you do this procedure, but you should remember it from peds. When doing the newborn bath, there's a few things that you need to remember. How big is this baby and is it appropriate? Is the baby warm enough? So the temperature needs to be 98 degrees, which converts to 36.7 centigrade. If the baby isn't warm enough, you're going to send it into distress. Is the baby's blood sugar stable? Some of the parents say do not bathe. They won't bathe them the entire time that they're in the hospital. That is their prerogative. At St. Joe's, we don't bathe the baby until mother and baby come up to the mother-baby floor, while others get their first bath in the delivery room. Always wear gloves until this baby has had the full head to toe bath because it has been exposed to the mother's body fluids. While performing the bath, you need to observe for mottling, tremors, color, because this baby gets cold very, very quickly. We like to do the bath under a warmer if they're in the delivery room, but if you're doing it up on a mother baby unit, there's a lot of air conditioning in those rooms, so really keep your eye on these babies. If the baby starts sneezing, use the bulb syringe and suction out the nares. And then there's a separate video, there's two of them, on how to do the baby bath. Because at Hogue, they put the baby in a basin, and every place else, they do it just laying on towels. At St. Joe's, we'll do it on towels or we'll do it in the sink. So it's facility specific, but it gives you a good idea. But these are the things you need to keep in mind on whether or not it's appropriate to give this baby a bath.